some practical tips on um, how you can help cyclists and how we can be clinicians that take a holistic approach that can be encouraging of cycling as a healthy behavior, but also look out for some of those pitfalls of where cycling can be let's say, a machine that can bring people's bodies out of balance, and some practical tips on how we can use the Winback as an adjunct and even a central player to accelerating that process and helping people make breakthroughs in their health beyond what was possible with standard care. So let me start again that share screen. And maybe just before, maybe a practical note, I'm using Keynote, and when I play some clips, I might just ask people, just until we know exactly how the level might play at home for you. I might cue people to turn the volume down on some of these videos that I'll play, just to make sure it doesn't blow out your ears. So let's get my presentation here. Okay, everyone's seeing us here?
Yes.
Okay. All right. So a little about my story as we get started. This is me bike racing just 2 weekends ago. It's the fall season, and my friend caught this photo of me mid-race, and it's always amazing to me to get a photo of what I look like to other people in action. What it feels like, is a range of difficulty, I would say discomfort, and sometimes abject pain in the body. And this photo here, shows there's quite a lot that's going, perhaps well, but also in a stressful circumstance. You can see, I'm putting my cervical and thoracic junction in a maybe a compromised position in order to make sure I'm looking through the turn to control the bike through this off camber downhill section that I'm about to enter here. And just kind of backing up a little bit about my story is that back in I started really seriously cycling in 2005 when I started college, and I loved it so much. It brought me community. It brought me this outlet for exploration, exploring the area around Iowa City, and the light bulb moment for me in terms of becoming an avid cyclist was um, my dorm mate coming back from a 50-mile ride out in the country with all these racers, and I locked onto that image that somehow spoke to me and said, "That's what I need to be doing. I want to go explore on my bike, and I don't want to be in a gym. I want to be out. I want to be, outside exploring and challenging myself." And a few years into it, I'm, pushing up against the, middle to what we consider kind of elite amateur status. And I start noticing a lot of pelvic dysfunction, a lot of pain in my back, my pelvis, my abdomen. And um, the advice I got from many doctors at that time was just stop riding, and the issue will abate and you'll be fine. And so this is an activity that had been a source of friends, a source of adventure, a source of my ego, personal identity at that point, and probably as we'll get into later, probably a source of dopamine addiction as well. And so for a doctor to tell me that you'd have to give up this hobby, that was pretty difficult to hear. So now here today, with everything I've learned and put in practice, all the help I've gotten from therapists, doctors, mentors, friends, I'm still able to enjoy my hobby, and hopefully be able to pass on that knowledge to patients that I help, and even my daughter is just now starting to ride her bike. So here we go. Um, there are three key areas I want to discuss today: how Winback can be an incredible tool to accelerate the progress that we have with people in the realm of bike fit, which is an art and science of adjusting the the components of the bike for the person's body. That also incorporates how they perform, how they move, and their comfort on the bike. The second realm that the Winback really helps with the uptake of helping people um, improve their mobility patterns with exercise. So the people on this call, we use the Winback as an accelerant to teaching exercise, to enhancing our ability to learn new exercise. And then that third, that's probably the most common, thought of way that we use Winback is to do tissue work. We get that person on the table and we change their tissues very rapidly with as little as 5 minutes of treatment. We can have a profound benefit on a person's joint, muscle, fascia, nerves, and yeah, we'll get further into it. So I alluded to this. There are many risks to being a cyclist. This slide shows a pressure map of saddle pressure, and this is an ad from a specialized bicycle company that is in basically direct response to this quote I'll read that's attributed to Irvin Goldstein, a medical doctor. He says, men should never ride bicycles. Riding should be banned and outlawed. It's the most irrational form of exercise I could ever bring to discussion. Okay. That's a medical doctor in 1997. Irvin Goldstein is, I would say, probably the foremost expert on pudendal neuralgia that I'm aware of, and a lot of his practice and teachings are a cornerstone of my pelvic floor practice today as a physical therapist. And so when I was suffering with my issues, I was looking at this quote and feeling like it was a big challenge and it was feeling very deflating. But the people along the way showed me there's a way forward here. Okay. There are billions of people that ride bicycles every day, and not every one of them struggles with impotence or pelvic pain or the female equivalents of those issues. And so there are solutions, but we have to be aware that as a culture that generally encourages exercise and cycling as one of those options, we need to be open-minded to the solutions and open-minded to adapting the bike to the person's body. And here's one of those solutions, which is an Italian-made SMP saddle. It's got a large cutout. A lot of prominent people in the bike fit arena use SMPs for clients that suffer from pudendal neuralgia. And just thinking of some of the bike positions that we'll see very soon here is that when we're asking for a stable pelvis, how are we going to keep a stable pelvis when also we have the potential to be compressing the the anterior pelvis into the saddle? And so here is just a little experiment I did on my own bike. I decided to do an audit on myself in preparation of this meeting. I'm going to start to play some videos. If I could ask everyone to just kind of check their sound, turn it down to like maybe 25%, just to make sure I don't blow anyone's ears out. Okay. So, okay, just looking out for a few aspects here. We're going to look at, in looking at any of these videos, we're going to look for the amount of heel, how high is the heel above the metatarsals. That's indication that the person might be reaching excessively to the pedals. The knee bend, okay. Of course, we're looking at spinal position, their hands on the handlebars, and later on we'll look for signs of shearing of the pelvis on the saddle. Okay, So this is the starting position that I've been riding for over a year. Okay. Um, Next, I'll show a saddle position that's slightly higher. I'm also playing this up for the camera a little bit. When I get lazy, look at my cervicothoracic junction. Look at that C7 there. And again, we're already coming up against I think one of the main issues of the upper quarter of the body is this cervical posture. We want to see down the road, or we want to, if we're in spin class, we want to look forward and see the teacher. But how does the rest of the bike set up that neck position, even compared to the neck position in the slide above? It's significantly more compressed, raising the saddle. Okay, going to the next video. This is a little bit higher still, and notice the amount of rocking in the pelvis. Look at the amount of turbulence in the body. Okay, and going directly from there to a saddle position that's much lower even than rest. This is now 1 centimeter lower than my resting position. Notice how the turbulence in the body is much less. The heel is a lot more level with the metatarsals. And look at the cervical position. Look at my hand position. They're relaxed on the bars. And so this position that I chose, after doing a couple different trials and looking at the results and feeling the results, also we're testing all of this at the same power output level on this bike trainer. And so that is the position that I'm going to go and basically do my Winback process with the bike fit, with the exercise, and with the tissue care. Coming out a bit, I just want to discuss about, maybe zoom out to, what is this realm of bike fit? What is this art and science of bike fit? It's its own specialty. And I am not putting myself out there as a specialist bike fitter. These are people in your community I would recommend seeking out for people that need a lot of in-depth care and a lot of special, if they have special circumstances, special needs. And this slide here is a gentleman who went to see my mentor here in Portland. The mentor's name is Michael Sylvester. He's known of as probably the father of bike fitting. And he absolutely transforms people's abilities and adapts cycles to help people make huge breakthroughs. But he makes drastic changes to people's positions, oftentimes forcing them to take positions that are a lot more lax than what they might be accustomed to. There's a lot of specialized tools. I mean, it's getting down to the millimeter and the degree of level. As we can see in this bottom slide, look at all the measurements involved that go into the consideration for a person that's in pain, and a person that wants to go for top performance, or a person that just wants to enjoy their bike more. Those are all different considerations. And if you are in a position to help a cyclist, know that there's a lot of options to help them. There's hopefully a few basic ways that you might come away with today that you can consider. So in direct contrast to Dr. Goldstein, and Albert Einstein loved riding his bicycle. Okay, and I think this is a great philosophy to carry forward in how we're going to treat this issue of cycling injuries. Is that we need to keep an open mind. We need to take all of our knowledge as clinicians and find a workable solution for the patient. That's it's not a stagnant solution. It changes over the course of the athlete's life. Their bike needs to change as their body changes. As we get tighter, as we get weaker, we need to address those changes both in their body and on the bike. So getting back to some demonstration here, just want to look at some pelvic shearing. And so these correlate with those positions I saw earlier. I'm gonna go from one extreme, which is the highest position, look at all of that rocking. So my nervous system has no ability to stabilize against a saddle that's too high. And my compensation pattern, as you can see, it's mostly in that mid thoracic area. And I still, I don't have any pain, but that's a problem. Okay. Going to the position that I settled on as a great improvement. This is a lot lower than this is about 3.5 centimeters lower than what I just showed you. Now I still have some shearing, but it's a lot less. Okay. And I would like to hand it over to Dr. Tucker just for a moment to talk about how is it possible that somebody, could cycle for months to years and be building up trigger points in the body, but not feel them at rest until we get our hands on their body. Dr. Tucker.
So I think that the current thinking on trigger points, Grant, is that it's muscle pain that can be categorized into three types, and it's muscle belly pain, origin insertion pain, and then referred pain. And the definition of a trigger point is a hyperirritable spot in the skeletal muscle that's associated with palpable nodules in a taunt band. And trigger points arise from taunt bands, and they cause a characteristic radiating pain. So there's three criteria for a trigger point, right? Distinct painful taunt nodule, referred pain, and then both local and distal muscle twitch response upon palpation. And we could have latent trigger points or active trigger points. I think that that's probably one of the answers that I would, those patients that we see that do come in with these hyperirritable spots to palpation that they feel. And then there are certain hyperirritable spots that we palpate that they may not be feeling unless they are activated. Does that help answer?
Yes. Yes.
Grant, can I throw one little thought in on that too?
Yeah, please.
With regards to why trigger points set themselves in place anyway. And in one of the philosophies or thoughts, especially in athletics and for sure in the cyclists, would be, they're producing fake stability. In a poor biomechanical pattern, they're there to produce, and that's why they're abnormal. So I just want to throw that in there.
Yeah, absolutely. A fake strategy for stability. A strategy that they have some compensatory pattern for. Thank you both. What I have here on this slide just kind of alludes to, if there is a unique aspect to cycling compared to other forms of exercise, is the risk to the pelvic floor. And this, this cartoon here of a pelvic floor exam and some possible areas of referral pain, we get, the local trigger point and then the distal. And so, hey, if you're seeing this person that has this, Travell referral pattern down their inner thigh, okay, are we thinking, is it a pelvic floor trigger point? Is it something that needs to change with their cleat pedal interface that's interacting with their groin muscle? Is it something from lower than the pelvis, or is it in the pelvis itself? It's just some things to consider. And these are things that I suffered with as a patient. And I think it's just, opens up a whole world of finding our friends locally that specialize in treating pelvic floor dysfunction. So now let's talk about solutions and options with the Winback. Okay, let's go into a little demo here. So I'm gonna put the soft patches, one on my abs and one on my SI area, because I'm going to go and I'm going to see if one of the RET EMS settings can help me learn better stability patterns while I'm experimenting with this new position. Okay. So then let's turn it on. So and right away, so I tried the new program there that was just released that Laura will talk about. And I have to say, compared to that, the deep setting, the deep focal setting, this new Sport Plus program, I feel it in such a different way. And I'm really excited to get, further into those new programs, but it feels amazing. So then I've got the patches on and I'm going to pedal away. And as I settle in here, I'm feeling the cycles on and off of muscle contraction as I'm getting RET to increase blood flow to some of these areas that I have trouble activating, recruiting my transverse abdominis perhaps. And, my feelings here are this turbulence is a lot less, and I'm able to lengthen my neck more. My heels are dropping. So it's helping me relax as I'm experimenting with this new position. And then here's the posterior view of that. And so, there's still some shearing, and we're still seeing some significant decoupling here in this, lumbar thoracic junction. But I'm going to, let's say at the last part of that little segment, you can see me start to lengthen my neck out, which is not something I was able to do in those other positions. And the length of the spine, has impact on our breathing patterns, has impact on how we are producing power. Because if we're not breathing properly with our diaphragm, that's going to impact endurance. So any of your clients that is going to put up a roadblock to you, putting them in a more relaxed position, tell them this: if you're more relaxed, you're going to breathe better, you're going to produce more power, you're going to win, or you're going to be more comfortable. And oh yeah, probably the last thing down the list that a lot of avid cyclists will, listen to is that, oh, you won't be in pain, but they'll thank you for it later. This, we've seen some videos already, but this aspect that the Winback allows us to focus both on the stability and the integrity piece. The EMS and the RET are incredible tools to help restore and regenerate, chronically overused tissues, or tissues that are damaged from, let's say, a traumatic injury or an accident. And it's also helping us learn better stability patterns. Now coming off the bike. Okay, so this is my friend Miguel, who helped me do some demonstration. He's had some SI joint issues in the past. And so this is, I believe, so we're going to click here. I think this is before turning on the machine. I see a lot of rounding. Okay. Okay, now we turn on the machine. Oops. Okay, so RET, EMS, the patient's feeling the energy flowing between his SI and the front of his pelvis. I've not given him any instruction or any other exercise. Look at the difference that we just created. A lot less thoracic rounding. Okay, so just turning on and off the device is enough to create a significant change in the moment of doing the treatment. And so doing this enough, it's a little bit of a parlor trick to show off the device. But it proves to me that something significant is happening. Blood flow is increasing to the muscle, which, can have so many different positive impacts. We're improving the sensitivity of the system. As the nervous system is calm, it allows us to move these different parts that have tightness and old injuries. And then also that muscle contraction is, I think, if it's not adding a true stability piece in the moment, it's cueing the motor program to to turn on and activate some of these areas that a lot of people might not be aware of their TA, but when they feel something helping them do it, we cue them, hey, when you feel the machine contracting, I want you to try to replicate it as well and help out the machine do what it's already doing. And so that's just, and you notice Miguel's dog. Okay, Miguel is a chronic pain sufferer. This is a service dog. He goes everywhere with this dog. Pain is a part of his life, and we've been working together. And the Winback, is kind of like this major piece of our care with his recurring with his chronic pain. Okay. Any questions so far? Oh, this is a cool one. Okay, now looking at a squat. So same sort of concept we're talking about here, how the Winback enhances movement quality. Okay, so he did a great squat, but we could see some limitations. So yeah, I mean, that's, that happens a lot. And again, that's not any other exercise intervention. That's not any other stretching. That's just turning the machine on and off to demonstrate the effectiveness. And how that relates, coming back into, I think, our limited time in the clinic, we can use this feature to show the person that these movements off the bike or outside of their sport, they're changeable with practice. And also it's giving this person, I think, a level of belief that their body can change, their body can feel different in a very, in an instantaneous way. And that they go home with their home exercise program that we video with their iPhone, and they say, oh, I want to do that thing that I did in the clinic, and I want to practice that thing. That's where, we all love what we do in the clinic, but we all want our clients to, be adherent and love their home exercise program. I think maybe one more thing I'll show with this feature is, exercises that relate directly to the cycling athlete that I would recommend, in addition to forward folds and squats. I think that straight leg raise is a great test to do. It's also a great exercise to do. Yeah. So straight leg raise, if we recall, going back to this side view of a cyclist, okay, the straight leg raise is, it shows us what tightness is in the back side of the body and what's the integrity of the VMO in the front side of the leg. So we get that person off the bike and how much extension they have at the bottom of the pedal stroke, therefore how far their tissues have to reach down to the bottom of that pedal stroke. If you're trying to get a handle on what's going on in this person's body, straight leg raise is a great analog or a great window into what's happening in their body there. Okay. Next, we have to understand how they're stabilizing or not stabilizing their pelvis. So we do some sort of dead bug activity. Okay. And, Winback is helping us the whole time. Some sort of bird dog, some sort of reciprocal arm leg extension. We've got a patch on the SI, a patch on the front of the abdomen. And again, those muscle contractions from the EMS, it's cueing him better than my hands could. It's getting deep into those, the transverse abdominis if I've got it on the focal setting. If I want to come more surface, for a different muscle group, I wouldn't recommend it here. But I love that focal setting for helping that person cue transverse abdominis, and then of course all the verbal and other sorts of cues can really help there. And bird dog is directly related to or that movement is directly related to what we talked about here with the pelvis rocking side to side. At the bottom, when I showed you, I decided, hey, here's the pelvic, here's the bike fit that I'm going to work on improving. Okay, that one based on other factors, performance being one of them. But once we're in the neighborhood, once we're in the ballpark with the bike fit, then we say, okay, it's good enough. Let's focus on how to optimize the body with exercise and with tissue treatment. Okay, so just presenting some locations here for treatment and options here. Okay, looking at the tissues that we want to, let's say, soften. Okay, I like to think of it like using CET on the fascial areas that we need to soften up those adhesions. And so down here, bottom left, CET on the quadricep into the hip flexor and around the iliacus. The cyclist has an incredible amount of restriction and dense tissue in that anterior chain. The quads are so often the dominant force producing group. And we're hoping to soften some of that tension so that other muscle groups can come online. And then let's say a little combination, softening with the CET and a little bit of engagement with the RET EMS is what I'm going to do here. So we get the muscles contracting to nourish the hamstring into the ischial tuberosity junction, and then the CET to help loosen up some adhesions in the gastrocsoleus, another chronically overused area for cyclists. Okay, and maybe just one more video on this page to highlight the beauty of the Winback. Oh, okay, so using these devices, we're able to work on large swaths of tissue with the Winback. We don't just have to be targeted, and this is, it's like, why did I get this guy, all the way undressed? Because in a short amount of time, I want to work on, this posterior chain from his thoracic all the way through his lumbar and into that lower extremity. And we're trying to train people to view their body as not segmentally, but moving from the whole body. We've seen how changing the body a few degrees or a few millimeters can affect not only how the legs work, but how the trunk interacts with that, how that impacts the neck, how that affects the upper body. And so I believe that, when appropriate, work on these tissues in these long tracks so that we're with our mindset, but also with what the patient's feeling, that we are unlocking the segmental approach, or this kind of balkanized approach to body parts, but incorporating let's say in short terms, kind of the anatomy trains approach to therapy. So hopefully so far, you felt like, what we've discussed just gives you some confidence based on what you're already doing with your patients from a tissue perspective, from an exercise prescription perspective, and using that Winback, with both of those, and hopefully being able to identify or discuss some points about how the bike fit and the body are integrated, and helping that person to to be open to different options there. And just looking at this picture here, being a cyclist means a lot of different things. Does it mean being a crazy racer? Does it mean riding a Dutch cruiser bike to get groceries? It's all part of being a cyclist. And just asking some questions like, hey, when was the last time that you adjusted your saddle position and experimented with how that feels? Empowering the person to experiment, knowing that there is no perfect bike position. We want the bike to fit their body. And really, this talk today, we could, if this talk was just a, kind of like a central link, we could zoom into each one of the specialties that we've discussed on the Winback AMAs for really in-depth treatments on what to do for sacroiliac joint dysfunction, the cervicothoracic junction, pelvic floor, foot and ankle, wrist and upper extremity. Each one of the segments that we can imagine, the cyclist needs optimal, they need optimal range of motion. They need good integrity of the joints. They need good strength and stability. And so, a lot of people gravitate to cycling because they have a limitation with some other sport. That's how I got into cycling, because my running was breaking down. And so I entered cycling with a way to get great exercise, train, exert my athletic ideals, but I had very poor ankle dorsiflexion. I had very poor hip extension, very poor pelvic and core stability. And so, if just giving you the confidence that somebody comes to you as a cyclist, just treat what you see. test and retest and go through your repertoire, and then ask them, see how this feels when you're back on your bike. And I think at this point, let's say, why cycle? What is cycling perhaps giving to the world that we really need? Okay, it is giving a fairly accessible way for a lot of people. If if they have a chronic disease, they can cycle. If they have an amputation, they can cycle. If they have something like Parkinson's, cycling is still a great option, because one of the things we have discussed is that diabetes and mitochondrial dysfunction is a scourge of our modern times, and we need solutions to help the population have a better option than just Ozempic, right? And so 45 minutes of zone 2 exercise 3 times per week is enough to reverse diabetes in 2 to 3 months, according to Inigo San Milan, who's a physiologist who trains both people with, he's a researcher in diabetes, but he's also the trainer for Tadej Pogačar, the 3-time Tour de France champion. And so what he applies at the Tour de France to win the Tour de France with his athlete is what he believes in for the health of people suffering from type 2 diabetes. And just some practical, this is so if you're just looking for a takeaway today, 45 minutes of zone 2 exercise 3 times per week. And what that feels like, what zone 2 is riding at an intensity. You can carry on a conversation, and you can maintain about kind of like saying a few words before taking a deep breath. That's kind of what it feels like when you're doing zone 2. If you can't speak, you're probably cycling a little too hard. You need to come down in intensity. Just a little quote there from Inigo San Milan. I mean, cycling is amazing therapy for the body if we get the adjustment right. Maybe an extreme example of a breakdown, I think, of the bike-body connection. This is a picture of somebody participating in Race Across America. This is not a backpack, or it is a backpack, but why he's wearing a backpack when he's fully supported by a van racing across America is he needs this PVC pipe to hold up his head, because of the mileage, because of the state of his body at the start of the race. He was not able to his posterior chain and the way that he uses head and neck in relation to gravity over the course of all these miles was not allowing him to hold his own head up. And yet he's still going to try to continue in this race. And so I think, one of our roles here is just, let's see what we can do as clinicians to maintain cycling as an option for, people of differing abilities to enjoy it for, in their life, and use it as that exercise that can really help people. Here's a little before and after. This is a person who, Vincenzo Nibali, a great cyclist, in this green jersey. This is before he really made his breakthrough. Look at his neck and chest position. Now look at him leading the Tour de France in 2014, being on a team that supplied him with a bike with a taller head tube, and he's got a much more open chest. You can see he's looking down the road, and his neck is in a much healthier position. It's a lot less aggressive. I mean, look, his hands are on the hoods, which is on top of the handlebars in both positions. So it's an analogous position. They're both climbing up a mountain. And so, the position, that what one position might look more aggressive, more aero, the better performing position is the position that is better for, the health of the body. Better performance and better health should go hand in hand, not be We should not have to leave health to reach for better performance. I want to show this here. This is a very experienced cyclist with, you'll see, some very poor off the bike mechanics. Okay, so you'll see he stops basically where his mountain bike stops. He doesn't go further forward without, he could round his back to maybe touch the ground, but that's all the hamstring length that he has, because he doesn't do much else. He doesn't engage in enough yoga, enough body weight calisthenics, other well-rounded activities, that so his body is stuck, kind of like how his bike is. Okay, and that's what you're going to see with an avid cyclist, and encouraging that person to do something else athletically, other than cycling. And then likewise, here's a squat, and I've got him hooked up to the Winback here. We're taking care of a knee pain issue on this person today. That's it. That's his squat. Okay, severe dorsiflexion limitation. Yeah, it's like, I mean, it's like you just want to like put the Winback everywhere. You just want to go everywhere for an hour. Okay. Gonna maybe prioritize. How are we doing? I think maybe last thing here. This is my last point of the day to discuss indoor cycling issues. The Peloton became very popular during the pandemic. Some very significant issues for the indoor cyclist compared to the outdoor cyclist is that it's a rigid platform, and rigid meaning here's the body moving on the trainer. There's no movement of the bike. There's nothing else moving. So the body is going to have a lot more buildup of stress because the bike's not moving, but also there's no resting when you're on a Peloton workout. A 45-minute Peloton workout might be the equivalent of an hour and a half out on the road, where you're coasting downhill, you're stopping at a stoplight, you're climbing up a hill. There's no change in terrain. So it's some of the issues that a normal cyclist might have outside get exacerbated inside. So any positional issue can get exacerbated. Here's a video of a race, and you'll see what happens. So my pelvic instability almost makes me wipe out on this beach. So all of that tail whip of my bike that came out on the sand, that my core and my whole nervous system had to feel and react against, so that I didn't just go down in the sand. And so I had that feedback externally. But cycling indoors, I'm just paying attention to what my training program is. I'm not there's no feedback about how I'm what I'm there's no skill feedback. So that's what I'll say there, and thank you for your time, and hope you guys got something practical out of today.
We did.